In this video, I'm talking about ribs and what it means when you let your ribs flare out, why that can be a problem, and how to avoid it. If you ever take a yoga class with me, then at least at some point I will tell you, cinch your rib cage in, draw your ribs down, something like this. And I understand that for some people this is kind of hard to understand. What does that even mean? Well, what happens very often is, first of all, if you're used to breathing in a way that does not allow the diaphragm to move up and down, and I've posted a video on this previously, so check that out, then what might happen is as your lungs expand, if you're only breathing kind of upwards towards your chest, then the rib cage opens up really wide to accommodate the expansion of your lungs with the inhale. And that's probably the best way to feel that rib flare kind of movement, is to take a deep breath in and keep it all up into the chest. So the first thing that you can do to avoid that is to try and breathe downwards as well. So the ribs don't have to do so much movement to accommodate the expansion of your lungs. And instead your diaphragm can do what it's meant to do and also move downwards to allow for that expansion. So a lack of diaphragmatic 360 belly breathing can be one reason that tends to occur, that rib cage flaring. Another very common reason for rib cage flaring is if you're doing anything that requires overhead shoulder mobility and your shoulders are tight, then what might happen is you need to get your arms up overhead, the shoulders stop, they don't go any further, so your rib cage does the work. Can you see the difference between this and this? Rib cage accommodating, shoulders doing all the movement. This is what we're more after, keeping the ribs down and in as much as possible, breathing still, normally, down into the belly, allowing the lungs to fill up in all directions, but without going into this rib flare. So why is it a problem, besides the fact that it's a sign of poor breathing habits and maybe a lack of shoulder flexion? Well, there's certain stability muscles that really need to be doing their job of keeping our joints stabilized that do not like rib cage flare. One of those is your serratus anterior. It stabilizes the shoulder blade, keeps it on the rib cage. If your rib cage is flaring out, then serratus is likely not working the way that it should. And a very common place where this is seen is downward facing dog. The rib cage flares out. The serratus, therefore, is not doing its job to stabilize the scapula, the shoulder blade, and then your shoulders become at risk of all of that weight that you're putting on them. Then you kick up to a handstand or a pincha, and you're not recruiting all of the strength that you've got right there just with that serratus, because it's just sitting there not doing anything. And all you need to do is draw the ribs in. Another muscle that does not like rib flare is your transverse abdominis. It's also likely going to be not quite activated, not quite able to do its job properly if the rib cage is flaring out. So how do you draw the ribs in? What does this mean? Well, it's what I was demonstrating at the beginning. It's the muscles through in between the ribs, which are called your intercostal muscles, as well as your obliques, and some other muscles as well. It doesn't matter. It's a matter of just using the muscle activation to draw your ribs from being flared out to bringing them in. So how to do this? It can be really helpful just to use your hands for a little bit of feedback. Place your hands on your ribs. Breathe in. Maybe let the ribs flare out. As you exhale, feel with your fingertips the way your ribs are moving as you breathe out all of your air. Press it all out, all of it, until there's nothing left. You'll have to use these muscles that I talked about to help press all of that air out. And those are the same muscles that you can use without expelling all of your breath. Those same muscles can work just to gently draw the ribs down and in. Another thing to think about is what your breastbone, your sternum, is doing. Because as I mentioned, what happens, especially when the arms go overhead, is the rib cage actually begins to tilt upwards. And what we do is we're going into a slight back bend. So the sternum goes from pointing kind of here to pointing kind of upwards. And that is another sign of this rib flare. So pay attention to when you bring your arms up overhead, if you can keep your sternum still. If the sternum lifts up, there's movement here, then you know that perhaps you are using a little bit of like rib cage movement to compensate for your shoulder movement. Now there's nothing wrong with this. Once you start to go into a back bend, then yes, you'll want that extension through the thoracic spine. But I want you to be able to do that separately to overhead shoulder flexion. And it can just be really important to understand, well, as I move into this range of motion, is it my shoulders doing it? Is it my rib cage doing it? How much is coming from each part of the body so that you can